Hi, this is Dr. Kant Shah, Pediatric Robotic and Laparoscopic Surgeon. Today we are going to talk about Laparoscopic Kasai Portoenterostomy surgery for biliary atresia. The liver makes bile which helps us digest food. If the bile ducts or the pipes are completely blocked or absent, this condition is called biliary atresia. If the bile does not flow, it damages the liver and leads to cirrhosis, which is permanent damage, and eventually liver failure occurs. Hence, this condition is not compatible with life if it is untreated. There are two main types of treatment available for this condition. One is a liver transplantation, where the baby's liver and bile ducts are replaced by another person's liver or part of a liver. The other is called a Kasai Portoenterostomy, which is done in the first 3 months of life. This is a surgery done to restore bile drainage from the liver, and many children who undergo these procedures may be able to avoid liver transplantation. So how do we diagnose biliary atresia? Well, a child who has jaundice beyond the first 3 weeks of life must be urgently investigated for biliary atresia. Also, children who have pale stools, which is like the color of my table or my shirt, white colored stools, or dark urine, or a liver which is palpable by a doctor, must be urgently investigated. The first part of diagnosis is to do a 4 hours fasting ultrasound. In this ultrasound scan, if the gallbladder is not well visualized, such children must be urgently referred to a pediatric surgeon who specializes in the treatment of biliary atresia. They would then do further blood tests to look at the liver function, and intraoperative cholangiogram, where we take x-rays to look at the bile drainage system, or a liver biopsy may be done. In some babies, when all the tests are clearly pointing towards a biliary atresia, the intraoperative cholangiogram may be immediately followed in the same sitting by a Kasai Portoenterostomy. So what is Kasai Portoenterostomy? Dr. Morio Kasai from Japan devised an operation by which the blocked bile ducts outside the liver are removed and a loop of intestine is connected directly to the liver surface. This allows free flow of bile from tiny ducts or pipes inside the liver straight into the intestine. We prefer to do this surgery by laparoscopy. This enables us to do the surgery by 5 to 3 millimeter small keyholes inside the baby's abdomen using an ultra high definition camera and precision instruments. The benefits are much smaller scars, far less pain, and faster recovery. Because of the very magnified view of the tiny liver structures, a better surgery can be done by laparoscopy. This is still technically challenging and needs an expert pediatric laparoscopic surgeon to do this surgery. The best results are obtained when this surgery is done within the first 60 days of life. With laparoscopic surgery, we are seeing better and improving outcomes and long-term survival of children, but some children may still need liver transplantation. What the laparoscopic Kasai does is that for such children, it delays or prolongs the need for liver transplantation. The best results for this procedure are obtained when the surgery is done within the first 60 days of life. Laparoscopic outcomes are improving with more experience and technology, and some children do very well in the long term, and liver transplantation may be completely avoided. Some others may still need a liver transplantation, but the need is delayed for a long time. After this surgery, most babies start feeding within the first 1 to 2 days. Children are usually kept in the ICU, where medicines such as antibiotics and vitamins are given. Children usually recover fully from this surgery after 1 to 2 weeks, after which long-term growth monitoring and liver function monitoring is done. 2 weeks back, we operated on a baby who was just 57 days old and had pale stools for almost a month and jaundice since birth. She was otherwise growing and thriving very well. As soon as the pediatrician detected the jaundice, within a day a referral was made to us, and we did some scans and tests and concluded that this child had biliary atresia. Immediately next day, a laparoscopic Kasai Portoenterostomy was done. She started feeding within 24 hours, and by 7th day she was discharged home. Today, she is passing yellow colored stools and her jaundice is decreasing. So in conclusion, laparoscopic Kasai is a life-saving first step for children with biliary atresia. In expert hands, it offers better recovery, smaller scars, and a real chance at normal growth. Early detection and timely referral to an expert pediatric surgeon is the key. This is a complex procedure and you may have more questions. Please do write them down in the comments and we will answer those. Please do like and subscribe our channel. Thank you.